Thank you very much indeed, Joe. May I first of all thank Sky for her warm welcome to country and also acknowledge the traditional owners of the land, pay my respects to elders past and present. I also wish to acknowledge my parliamentary colleague Melinda Pavey, the Parliamentary Secretary for Regional Health. I wish to acknowledge my other parliamentary colleagues, Troy Grant, member for Dubbo, Andrew G, member for Orange, also Dr Mary Foley, the Director General of the Department of Health, Dr Robin Williams, the Chair of Local Health District, Lynn Weir, who is the Acting Chief Executive of the district. I want to also acknowledge the Mayor of Forbes, Phyllis Miller. You're here somewhere, Phyllis, I understand. Welcome. And Richard Mutton, Deputy Mayor of Dubbo. There are many other councillors. I wish to welcome and acknowledge you. Also, all of those who've come from the various health councils representing the smaller communities outside the district, outside Dubbo, all of the members of the board. It's so thrilling to see so many of you here. I'm really pleased that you're here. Also, the many staff members from not only the Western New South Wales district, but also the Ministry for Health. You're right, Joe, and I want to acknowledge you and thank you very much for agreeing to be the Master of Ceremonies today, because I know how much you're respected in this community. Can I tell you a story? When I first met, I'm terrible at telling stories, but here I go. When I first met Joe, he had something to do with the clinical school here, and it was a very brief meeting, and he said, look, if you ever become the minister, just do one thing for me. Could you give me double the time for these students out here? And I said, sure, what's that for? And he said, I can marry them off then. So I've always had a soft spot for Joe Canalisi ever since. I think they do that now, Joe, and some of them do get married. But I also want to thank all of those people who've welcomed me over so many years. And Joe's correct. When I became the minister, that very week, the first hospital I visited, and I'm delighted to say I was accompanied by the Director General, who became the Director General the same day as I became the Minister, and we came out to Dubbo Hospital. It was a fantastic visit. We met many of the staff members. We took much longer than I think the administrators thought we should, but that's how I like to visit, to do things. Spending a lot of time talking to people on the ground, because if you don't talk to people, you don't get it right. And really, that's the basis of this forum. I know that we've got great challenges, Robin. You've been very clear in outlining many of them, but I think that what we're doing, and certainly this last couple of days, I've been at Broken Hill and Wilcannia with Mel and others, with the flying doctors, and they flew us to Wilcannia, and they've got a representative from the board here tonight. One of the things that I'm noticing is that devolution, that giving local people a much greater say in how they address the issues in their local area, really means that they've got a much more flexible approach to getting things right. And I think that's going to pan out over coming years to be the way that we move in the future. So if I had to summarise my vision for health, it would be about patients are the centre of attention. Everything should be patient-centric. Anything we do is designed to provide better care for patients and keep people well and healthy. I want clinicians who are happy, and by clinicians I mean doctors, nurses, cleaners, cooks, anyone who has anything to do with the health system, whether in a hospital, a community health service or anywhere else. I want them to be happy, fulfilled and jumping for joy at the idea of coming to work, because they'll know they'll be able to treat people the way they should. And I want people to be realistic in expectations about what we can do. We've got to work together in collaborative partnerships to make sure we spend our resources in the best possible way. First of all, to prevent ill health, to keep people well, to manage chronic illnesses so we don't end up with people unnecessarily hospitalised, but when they do need hospital treatment, to provide it in the most effective way possible. And I believe we should try to do that wherever people live. and I've been really impressed with some of the work of the flying doctors. I've been with them many times in the past, but particularly in this time where we've got floods. And I've just come from, and they've said, I can say today, if anyone's out there isolated with a major health problem, they're there to help. And that's the kind of partnership and collaboration that I think we can all benefit from. So I look forward to hearing what you have to say today. I will answer if there are any particular questions that I feel I can answer. I'll take on board all of your comments. And there are people in the room, if you've got specific concerns, you don't want to raise them, you can go to them directly. And also some of the people from the Western New South Wales district will answer questions, or the ministry. Thank you very much indeed for coming. It's great to see so many of you here.